when you said there's a lot of science behind that, how does the body go?
Early 2011. So there was a small group of researchers in the north of England in Newcastle. So they were studying a small subset of 10 patients, put them on a diet, got them to lose weight. They studied their pancreas. Within 11 days, they found that the fat in the pancreas disappeared. The fat in the liver disappeared, and their pancreas started functioning normally again, producing good amounts of insulin, and all of these people went off diabetes medications. And then in 2017, the direct trial proved that if you lost a good amount of your body weight, that is if you are obese or overweight, then your pancreas loses fat. And actually that's when they proved that this fat in the pancreas is what caused diabetes.
Welcome to Health Inside Out, a Kauvery Podcast.
You heard that track on Fever 104 FM. This is Cheyenne on the Superhero Show, and it's time now for Health Waves from Kauvery Hospital, Marathalli. I've got Dr. Hema Venkataraman joining me in the studio today for a very insightful discussion which will be about diabetes and much, much more. So Dr. Hema, first of all, thank you so much for coming to the studio.
Thanks for having me.
As we begin, can you kindly introduce yourself once for our listeners?
So I'm a senior consultant endocrinologist at Kauvery Hospitals, Marathalli. So after nearly 18 years working and training abroad in the UK, I've moved to India this year.
Oh, is it?
So it's a fascinating world. Diabetes, as you know, is quite prevalent in India, and there is a lot of need for education and work for diabetes in India. So yeah, that's me.
Welcome back to the country, for that matter. Okay, let's start with the first question. Now, most people believe that diabetes is a lifelong condition, but we're hearing the possibility of something called reversing it. What does it mean to reverse down or quiet down diabetes, and is this something that we can, have hope for?
Yeah. So until 2017, we all were taught to believe that diabetes is a progressive disease. It is a lifelong progressive disease, and that's what I read in medical school textbooks as a young doctor growing up, and that's how we practiced. So in 2017, things started changing. So there was this trial in the UK, a research trial that showed for the very first time that diabetes could be put into remission. Remission means getting your sugars into normal range with no medications by some lifestyle changes. So the very first time they showed that your pancreas could be rebooted. They called it the rebooting of the pancreas. So that created a lot of interest, and it changed the way we looked at type 2 diabetes. So 2017 was the game changer, and the name of the trial was the direct study or the direct trial. After that, we've sort of changed the way we look at type 2 diabetes, especially newly diagnosed diabetes. So I wouldn't call it reversal so much, because reversal gives you a sense of finality. So if I tell patients you can reverse your diabetes, they think they can be done with diabetes and go back to their old lifestyle. That isn't possible. But you can put diabetes into remission. Remission means getting your sugars into the normal range, keeping it there with some effort, with some lifestyle changes. And as long as you maintain that, you can manage your diabetes or keep your sugars in the normal range with no medication. So diabetes remission, in common words, reversal, is possible, definitely possible for people with type 2 diabetes, and there's a lot of science behind that.
All right. So when you said there's a lot of science behind that, can you tell us, how does the body go from managing diabetes to actually being able to push it into remission, for that matter?
So I'll tell you a little bit more about how that research trial worked. So early 2011, so there was a small group of researchers in the north of England in Newcastle. So they were studying they only had a small subset of 10 patients, put them on a diet, got them to lose weight. They studied their pancreas. What they found, lo and behold, within 11 days, they found that the fat in the pancreas disappeared. The fat in the liver disappeared, and their pancreas started functioning normally again, producing good amounts of insulin, and all of these people went off diabetes medications. So this small little study that laid the framework for a bigger study. And then in 2017, the direct trial proved that if you lost a good amount of your body weight, that is if you're obese or overweight, then your pancreas loses fat. And actually that's when they proved that this fat in the pancreas is what caused diabetes. So if your pancreas lost that fat, it actually even changed shape, and it actually became, the shrunken fatty pancreas actually became nice and normal and started functioning normally again. So there is evidence to say that this rebooting happens in type 2 diabetes. And yes, of course, it is not forever. There is a window. before which this reversal or remission is possible. It is proven that up to 7 years or 6 years of diabetes, newly diagnosed diabetes, you have a good chance of putting your diabetes into remission or reversal. The longer you have, maybe the damage may be more permanent and your chances of putting into remission may be smaller. But there is science behind it. So this rebooting of pancreas is new. There is something called a twin cycle hypothesis for people to go away and read if they want to. But there is science behind it. And it has been proven both by looking at the pancreas and studying the pancreatic fat and also looking at blood sugar levels in the human to see how the blood sugars go down in the process of remission.
All right, moving on, that's twin cycle hypothesis. Right, twin cycle hypothesis, that's we should all Google. I will as well on my end. Now, many people think that diabetes control is all about sugar levels, but how do other factors like weight management or improving insulin sensitivity play a role in possibly reversing the condition?
Sure. I again want to make a point that we're talking here about type 2 diabetes. People with type 1 diabetes, this remission reversal does not apply. All of you with type 1 diabetes must safely take your insulin. So this does not apply to you. This is the disclaimer that I want to make.
That was a question I had for you later on in the interview, but okay.
As we speak, I think it's safe to have this disclaimer.
Right.
So type 2 diabetes is about insulin resistance, where your fat in the body makes the insulin less effective. That is one. The second, as I said earlier, pancreatic fat. The liver is fatty, the pancreas is fatty. So when the liver is fatty, it makes you insulin resistant. When the pancreas is fatty, it makes the insulin, it makes less amount of insulin being released from your pancreas. So these are two factors in type 2 diabetes. Yes, you can reverse or you can actually get it under control. So the key factor for diabetes remission is weight loss. Or fat loss, as you call it, weight loss. And there are various ways to achieve weight loss, but weight loss is the key, and that was the underlying principle in all these trials. So if you lost 10% of body weight, you can get your blood sugars to a certain level. If you lost 25%, you probably reversed it. In the diabetes direct trial, there were really obese people with average weight of 100. So if they lost 25%, most of them went into remission. In India, the scenario is slightly different because we see lean diabetes, we see people who are not so overweight, not so obese with diabetes. For them, it's a little bit of a challenge, which again means that you need to come and see your endocrinologist to get a proper customized plan and not one rule fits all. Yeah.
All right. Now, for listeners who are listening to this and thinking of reversing, quieting down for the diabetes to go into remission, how long does it typically take to see meaningful results? I mean, you mentioned in that trial it took them 11 odd days for them to notice a change in the pancreas, right? So how long will it take for them to see results?
So typically, by definition, diabetes remission means keeping your HbA1c, which is the 3-month average, as you might call it. It's a 3-month test, below the diabetes range, below 6.5, for a period of 3 months without medications. And before you achieve that, you should have done some lifestyle change for at least 3 months. So by definition, 6 months is the minimum. So there are lots of multiple, companies, startups, multiple individual practitioners who are attempting remission. And there are lots of adverts out saying, I will reverse your diabetes in 7 days, in 10 days. So by definition, remission means you need to have at least a period of 6 months, 3 months of lifestyle change, followed by 3 months of maintaining that with a normal HbA1c for another 3 months without medication. So 6 months. Give yourself a good 6 months, probably longer. Some people need longer to change lifestyle. Lifestyle doesn't change overnight.
Right.
So minimum 6 months.
Right. Now, people have heard, and we've all heard about people going off the diabetes medication after entering remission. How safe is it to stop that medication? And is that like a once and for all kind of scenario? What would you say?
So that is the thing where a professional or a specialist will come into play. So lifestyle change people do themselves. There are a lot of my patients who actually get diagnosed with diabetes and then they attempt lifestyle change. They make change in the diet, they go into a healthy lifestyle, they join the gym, etc. But if they're on medications, I definitely want them to manage this with me, with an endocrinologist, because there are certain medications that are quite that cause low sugars if you don't cut them down. So the mistake people do is they go on a lifestyle change, but they don't adequately reduce these medications sequentially in a stepwise manner. So they need to come down safely based on their sugar values. Can you stop them? Yes, you can stop them. If your blood sugars are in the normal range, there will come a point where you don't need them anymore. But again, I would like to re-emphasize that stopping these medications is fine if your sugars are okay, but do not think this is a final end-all game and you can go back to your old lifestyle and still not take medications. Achieving remission is great, but maintaining remission is hard. Keeping that remission going in a sustainable, meaningful way without medications is also very important. So the end point is not just achieving remission, getting your HbA1c fine, done, I'm done, let's go hit the
Yeah, it doesn't work like that, huh?
Yeah, that doesn't work.
And something that you've already answered doesn't work is that this will not work for type 1 diabetes. So for type 1 diabetes, that's a lifelong condition. Like it can't go back into remission is what you're saying.
Currently, with the current advances in medical science, we don't have this. Never in medical science.
Right.
So, currently with the advances we have, people with diabetes, type 1 diabetes, must take their insulin. Before the 1940s or before the 1920s, there was no insulin. People with type 1 diabetes died without insulin. Insulin is a game changer. So insulin keeps you alive if you have type 1 diabetes. So do not miss your insulin. There's a lot of technology available for type 1. There are pumps that pump in insulin continuously. There are sensors that read your blood sugars. And then there are sensors that talk to the pump and say, hey, give this much amount of insulin for this much blood sugars. It's the artificial pancreas. So there's a lot of technological advancement in type 1. So don't be disheartened if you have type 1. You have the top-notch technology available in the market for type 1 diabetes. But please take your insulin and do not attempt remission on your own. It's good to have good lifestyle, eat healthy, exercise and all of that, but don't do it with the intention of coming off insulin. That should not be your end goal.
Now, when you said, don't do something on your own like that, let's say somebody who's listening to the show has type 2 diabetes and maybe it's not that serious, whatever. And they are hearing this and they think, hey, maybe then I can effect some lifestyle changes and go into diabetes remission myself. Why do I have to go to a doctor for that matter? What do you say?
Young people are very tech savvy and smart these days. ChatGPT, of course, is there to help you. So I think there's a lot of information available on the internet, which is a good thing and a bad thing. So to know what to filter out and know what not to filter out is a little bit hard, and that's where we come in. So I think you need to see a specialist or an endocrinologist for a few reasons. One, to check whether you are eligible for remission first. Not everybody with type 2 is eligible for remission. Examples are lean type 2. The elderly with type 2, long duration, or people with type 2 diabetes with other problems already existing. You need to be a little careful doing these things on your own. So, see your endocrinologist to make sure, are you eligible for remission? 2, if you're on medications, then you need me, definitely. ChatGPT can't do that.
Okay.
If you're on medications, I need to know which one to cut down, where, at what point, and that I need to do. And number 3, I think you also need me to maybe validate your strategy. You need a sustainable method. There are lots of methods out there, keto diet. Starvation, for example, you can just go off carbohydrates completely and you can go into remission, but is that a sustainable way?
No, you can't sustain that on the long
term. So you need to see me to make sure, or you need to see a specialist to actually give you that validation to say, hey, remember this is going to be a lifelong change. It's not a 3-month or a 6-month change. Whatever you're attempting now is going to be with you for life, and that's what you're starting off on.
Right.
So you need somebody with the expertise to say this is a sustainable way and a safe way also. So
right.
You need us somewhere, but you can do it. There is a lot of DIY happening in medicine, which is a good thing, but not so safe all the time.
Talking about new research, now I'm putting you in a spot this way, but is there any new research that's being done on diabetes that has caught your eye, since you seem to be somebody who's very updated with all of this?
So in the world of diabetes remission, if you talk about, diabetes remission has caused a lot of interest among us and patients, people with diabetes. But we don't know whether people with lean diabetes, for example. So there is a study called the Retune study, which is something that is that I'm quite keenly watching. That studies reversal of diabetes or remission of diabetes, correcting the word, in lean people, which most of us Indians are. Majority of our Indians are not the obese people with diabetes. We are lean, not so lean, slightly overweight. So there is evidence to show that you don't need to lose that much weight. Even with a small amount of weight, it is possible, which is quite a good outcome. And of course, you you must have heard, all of us have heard, the new drugs in the market, the GLP-1 agonists, which are weight loss drugs, Ozempic, right? Yeah, there's a lot in the market, a lot of news. So those are the newer, should I call them wonder drugs? Maybe for obesity, but they're new drugs, and they are out to change the way we manage obesity.
Right. But again, the long-term studies on them have not been done. Is that that's what I hear? I'm not sure.
So yes, they are new drugs. So we don't have such long years of data. But the early data does show that there is heart benefits for the kidney, and obesity benefits. Of course, every drug comes with its risks. So please do not buy Ozempic off Amazon from somewhere. So, that is also happening. So, yeah, there are new drugs in the market. Then there's new technology. Like I just said to you, the closed loop, the artificial pancreas, which might interest a lot of tech-savvy guys listening to this program. So you have the artificial pancreas where you have a sensor, and the sensor talks to your pump. Sensor checks your blood sugars, and
the sensor is on your hand and the pump is on
on the tummy. So the sensor is on your hand. It's a small little patch that checks your sugars every minute. And that sensor via Bluetooth talks to your insulin pump that's giving you the insulin. So if your sugars are going low, it tells the pump switch off. If your sugars are high, then it tells the pump, give it a little bit more insulin. And if you're exercising, you can tell the sensor and the pump saying, I'm going to exercise now. And therefore, it learns. Basically, it's an AI-driven algorithm that it learns. So I think that's a huge game changer for people with type 1 diabetes who had to take multiple injections every day, had to check their sugars multiple times every day. So it is here to stay. And thanks to technology, I think that algorithm, we have I think 1 or 2 sensors available, closed loops available in the country. But many more to come.
Wow. Okay, final question before we let you go. People have heard stories about reversing their diabetes or going into remission. Is it possible for most people, or is it something that only works for a lucky few?
Very good question. So this is something I definitely take home point. Diabetes remission is definitely possible. Definitely possible in type 2, especially if you are recently diagnosed. Okay, so I think you should explore this with your doctor, with your endocrinologist when you have newly diagnosed diabetes, to say, hey, am I eligible for diabetes remission? Can I give this a try before going on the long list of medications? But it is not for all. And I very clearly have to give this message. It's not for everybody. It's for type 2 diabetes. Clearly the type 1 is ruled out.
Right.
It is for the people with a short duration of diabetes. 7 years is my cutoff. So if it's 7 or 6 years under, then I tell them you have a good chance. But I do have seen people who have gone into remission with 10 years of diabetes. I have seen people with more than 10 years too, but that is a minority. So I'll say duration is important. Type 2 is important. People who are slightly on the overweight side or the obese side have a bigger chance because they have a lot more fat to lose. People who are lean with diabetes, what do I ask them to do? How do I ask them to lose weight? So their chances of remission are a little smaller than people who are slightly on the overweight side. And the worse your baseline lifestyle is, if you're out drinking, Coke and burgers on a day, you have a big room to change. The bigger your room to change, I think your chances are better. If you're already eating salads and you have diabetes, then I don't have much of a room to change. So yes, it's not for everyone. You need to come and see us whether you tick the boxes, fit the criteria, and also your pancreatic function. We sometimes measure it. And if you're good pancreatic function, and I say, okay, there's a good chance of remission, let's try it. But it has to be tried safely under supervision.
All right, Dr. Hema Venkataraman, thank you so much for coming to the Fever Studios. This was a very insightful chat. I got to learn quite a bit, and I'm sure people listening in who've, if their family members had diabetes, if they have diabetes, it does them a world of good as well. Thank you so much for coming to the Fever FM Studios. I hope your first radio interview, as I understand, was a good experience.
Thank you. Thank you for having me.
Yes.